This presentation, What Assistance is Available for People with Disabilities, is geared for families who have a member who has a disability and individuals who have a disability. It is presented by Granite State Independent Living's Financial Planning and Benefit Services. Some possible assistance is through Social Security, which can provide financial assistance, and through Medicaid, which can provide medical coverage. What is Social Security? Social Security is a federal program that can provide financial assistance to people who have a disability under two different programs: Supplemental Security Income, SSI, and Social Security Disability Insurance, SSDI. How does Social Security help a person with a disability? Social Security can provide financial assistance to people that meet the eligibility requirements, especially if you are not able to work because of your disability. It can help provide that support for you in the meantime. What is the difference between Supplemental Security Income, SSI, and Social Security Disability Insurance, SSDI? For SSDI, there is an age requirement of 18 to full retirement age. You have to have a significant work history. You can receive it if you have had enough work history, if you have a parent that is retired or disabled and receiving benefits, or is deceased. This is known as the Childhood Disability Benefit. Or if you are a disabled widow or widower and your ex-spouse or spouse had a work history. You receive Medicaid coverage after 24 months. There is no unearned income or resource limits. And if you have minor children under the age of 18, they can also receive auxiliary benefits off your SSDI record. For SSI, there is no age requirement. You can receive it as a child or an adult with a disability, or if you are over the age of 65. It is a needs-based program. Is for someone who has limited to no work history. There is an unearned income limit of $741 gross per month in 2014. There is a resource limit of $2,000 for an individual and $3,000 for a couple. You can have Medicaid coverage. In New Hampshire, it is not automatic. You have to apply separately for Medicaid. The maximum SSI cash benefit in 2014 is $721 per month for an individual and $1,082 per month for a couple. For more information, please see the separate presentations on SSI and SSDI. If you already received disability benefits but aren't sure what one you receive, you can ask yourself a couple of questions. Do I receive one check or two? If you receive two checks, you have both benefits. How much do you receive? If you receive $721 at the first of the month, then you probably have SSI. If you are working and the amount changes, then you have SSI. If you receive more than $721 and it does not change month to month with earnings, then you probably have SSDI. If you are not sure, you can contact Social Security. Do you have Medicare? If you have Medicare, then you have SSDI. Another question you can ask yourself is SSI is paid on the first of the month and SSDI is paid on the third of the month. For more information, you can also see the presentations on SSI and SSDI. What is Medicaid? Medicaid is medical coverage that is provided through the state of New Hampshire that will cover most medical costs from doctors, medications, and so forth. Okay. Children, people with disabilities, and low-income parents with minor children could be eligible for Medicaid. Okay. For more information on the Medicaid programs available, please see the Medicaid presentation. How can Medicaid help a person with a disability? Medicaid can help a person with a disability because if they do not have medical coverage, it allows them to receive the medical care they need. Okay, especially if you have a disability that requires multiple medications or doctor visits. it can help you get that assistance without a lot of out-of-pocket costs. You want more information? Here's how you can get more information. You can view the rest of the videos to learn more. You can contact Grandstate Independent Living for assistance. The Financial Planning and Benefit Services number is 877-809-7028. Website is www.gsil.org, or the email is benefits@gsil.org. You can visit the New Hampshire Work Incentive Resource Center for more resources at www.nhwirc.org. You can contact Social Security Administration and/or New Hampshire's Department of Health and Human Services for more details. Social Security's website is www.ssa.gov. The Department of Health and Human Services website is www.dhhs.state.nh.us. If you're connected with an area agency, mental health center, or vocational rehabilitation, you can contact them for more information and assistance.